Hello everyone and welcome once again to my channel. I'm a seasoned and certified medical microbiologist, popularly known as the medical professional with the difference, because I bring you knowledge like no other to the comfort of your living room, to your doorstep. If you're a returning subscriber, this is me saying thank you. And if you recently stumbled on this channel, stumbled on this video, do subscribe. Join the family, like, share, and subscribe, and increase the visibility, of course. And remember, I love you too. Let's roll in. In today's class, we are going to be talking about vaginismus. Now, what is vaginismus? It's a sexual dysfunction. This is when the muscles of the vagina actually tighten and contract, preventing penetration through the vagina. And what are the causes of vaginismus? This is actually a body and mind condition in which the woman is afraid of pain. In fact, what happens is most women who suffer from vaginismus are actually trying to protect themselves. So most women who have vaginismus, who are struggling with vaginismus, actually do have very difficult relationships. In fact, their marriage is strained. Sometimes they're not even able to consecrate their marriage. They're not even able to have sex. And most couples at some point even go to in vitro fertilization and end up giving birth to C-section. It's a very serious condition, guys, and it's not something that is talked about often. Many women experience this, especially if she has experienced some trauma in her life, maybe physically, emotionally, it could be medically, it could be some form of injury she had or experience like a bad relationship, especially rape. Now, there are two types of vaginismus. There's a primary and there's a secondary. Like I mentioned before, vaginismus is a body and mind condition, and it's caused when the brain or the woman's body is trying to protect herself from feeling pain. So that's a simple way of putting it. And for the primary vaginismus, this is for women who haven't started getting sexually active, haven't started having sex. And most times, women who experience vaginismus, primary vaginismus, are women who are rape victims. Now, it's very difficult to treat or actually women who are rape victims because they need a lot of therapy. They need the right partner to get them out of it. And most times, most rape victims actually go on to having sex just for the fun of it, not for pleasure, not for childbirth. And the other point on the primary vaginismus is it's in a culture where women are being brought up to believe that sex is a bad thing. There are some religions, there are some cultures that train women. In fact, they actually make women to believe that sex is a taboo, especially if it's in a culture where women are genitally mutilated, where their clitoris is cut off, where their labias are being sewn and all that. So this is a very serious issue amongst women, and I'm telling you, you will be very, very shocked of how many couples go through this. And this puts a strain on the man because the man is really tempted to go out and have sex. But men who really love their wives and who are in for the commitment bit actually seek a lot of attention, medical attention, a lot of therapy for their wives, in fact, for their marriage. Now, the second stage of vaginismus is when the lady has been sexually active before and all of a sudden she develops vaginismus. That means she doesn't want to have sex anymore. And when I'm talking about vaginismus, before I continue, I want to just go into the symptoms of vaginismus. Vaginismus involves pain during penetration, in fact, painful intercourse. In fact, you can't have sex or even have any form of penetration, whether it's through a tampon or whether it's through as a spectrum that is being inserted for a medical exam, anything that has to do with penetration causes pain in a woman. So back to the secondary form of vaginismus. So this is a lady who has actually been having sex before, and all of a sudden she develops vaginismus. She doesn't want to have sex anymore. In fact, she's protecting herself. Some of the reasons for secondary vaginismus could be rape. Another could be a pelvic surgery or some form of surgery that has happened around her vagina or pelvic area, that causes her to tension the muscles of her vagina, or tighten the muscle of her vagina because she's trying to protect herself from pain. We also have vaginal infections such as thrush. We have some vaginal infections that actually cause vaginismus, and also bladder infections. And also, if a woman has had a difficult vaginal delivery, it's going to be very difficult for her to, have sex again. If she has had a lot of tears down there, a lot of things going on down there, she is going to try so hard to protect herself. And also women who are on menopause, women who are going through menopause actually experience vaginismus. It's also because of the drop of the estrogen levels, and that causes a lot of vaginal dryness. And when you have vaginal dryness, and when you have sex, you have vaginal dryness will lead to be bleeding during sex. So a lot of women who are going through menopause actually experience vaginismus. Now, what are the diagnoses of vaginismus? It could be from mild, moderate to severe. Now, how do we treat this issue? Because it's a very serious problem. And a lot of people may minimize it, but even at the mild stage, it could break up a home. Now, the first thing you have to do is identify the problem and the causes. What could be causing vaginismus? If you do all the tests and find out that the lady doesn't have any form of infections, if she has not had any form of surgery, if she has not had very difficult childbirth or deliveries, she's not going through menopause, then try to look at it for maybe it's a bad experience she had, before she got married, and that could be stopping her from enjoying sex, or maybe she's no longer emotionally attached to her partner, So these are the things you need to look at. Or maybe her partner cheated on her, or something may go on. So you have to look for the cause. And the causes, and this form of treatment doesn't only come through scanning through the medical side. You have to scan through physical side, the medical side, the emotional side as well. Her past has to be screened as well to find out what may really be causing the lady to tighten or tensing the walls of her vagina anytime that she is having a penetration. It could even be a medical exam, or the doctor or the one of the nurses trying to take a vaginal swab. They are not even able to insert the speculum to take a swab. She's not even able to use a tampon, So these are things that medically you need to start looking at. And the second thing is you need to relax the woman's mind. If you find out that it's an emotional problem, try a lot of therapy. Shouting wouldn't solve the problem. Try to find out with a lot of emotion, with a lot of concern and love, and this also would have to involve her spouse. Her husband needs to really, really be involved to find out what could be causing his wife to resist affection from him. And the third thing is Kegel exercises to try and reduce the intensity, the tension around the pelvic area. Swimming also helps. Kegel exercises help Try to get your spouse involved in a lot of outdoor activities. Take her on a holiday. Let her get, rebooted. Take her to a place she wants to go. In fact, try having sex with her in a different environment other than your house or on the bed. Try having pleasure with her without penetration. And this leads also the next point, is that you could actually try to masturbate with your partner to get your partner a little bit relaxed. So this has to involve both the man and the woman in the marriage. Try to play with her, do a lot of foreplay. If you're involved into oral sex, do it. Do a lot of masturbation amongst each other. Try to make her have orgasms even without having vaginal penetrations. Try to get her more relaxed and comfortable, naked, being around you. Make her want it as well. Allow her to come towards you. So these are the things you need to do. And one of the last things you also have to do is to get vaginal dilators. Vaginal dilators are actually used to dilate the vagina. You actually put it in the vagina and it helps to contract and relax the muscles of the vagina. Vaginal dilators are used by a lot of trans men, people who are transitioning from man to woman, and to dilate them. So these are the very points. These are the points that you need to follow in order to treat vaginismus completely. Thank you for joining me in today's class. I remain your seasoned and certified medical microbiologist, medical professional, Gwendolyn Halley. Till next time, bye-bye.